Hi everyone, and welcome back to my series of endometriosis, and I hope you're not too bored with endometriosis because incidentally March is endometriosis month. Yeah, so this is an endometriosis month. So to create more awareness of endometriosis, if you're in your late 40s, you actually have a few things you need to think about. First, I want to know whether the endometriosis is affecting you. That means, are you having a lot of symptoms? Are you having a lot of pain? Is it causing problem on your kidneys? Is it causing problem on your breathing? If let's say it's not causing you any problem and you're in your late 40s, some of people will actually choose not to do anything. Because we know endometriosis goes away after you menopause. You can choose not to do any provided few things. Number one, it's not causing you trouble. Number two, it is not too big. Because when it's big, I'm always worried about cancer. We talk about the cutoff point of 3 centimeter. Anything more than 3 centimeter, there's cancer risk. Less than 3 centimeter, you are 100% safe, no cancer. So you have to think about it, and cancer tend to come with older women. So when you're talking about late 40s, you're considered older women because endometriosis goes away after menopause. So most people who get cancer from endometriosis are usually also in their 40s. So I will also think about that. Okay, then second option is whether I want to take medication. Of course, medication is a good option, but you need to take until menopause. If you're in your late 40s, then it's not long after you won't menopause too late, hopefully. Some people menopause when you're 60, So you are going to continue medication until you menopause. That's the only thing you need to ask yourself. Are you willing to continue medication until you menopause? The advantage of taking medication is that I suppress the disease. Let's say now the disease is not very big, everything is not very big. I suppress it so it don't get worse. That is the advantage. That's the main advantage. Number two is the pain that you're having and all the suffering that you're having. Because if you take medication, then the pain will go away. Whatever you're suffering, it will go away. But do you have any side effects taking medication long term until your menopause? Yes, because all endometriosis medication is some form of hormone therapy. And the hormone we talk about, as I talked about in my medical treatment for endometriosis, is actually progesterone. So when we talk about progesterone, one thing that we worry about progesterone, we only worry one thing. We know that hormone treatment doesn't matter whether it's progesterone or estrogen or any hormone treatment. The blood tend to be thicker. Then when blood tend to be thicker, we also worry about it block our blood vessel. So we actually worry about things like stroke, heart attack. We worry about blood vessels being blocked. Let's say you are 20-something, 30 years old. We are not so worried about this stroke and all these things because you're young. And maybe you're so much healthier. No high blood pressure, no diabetes. Your weight is normal. You have no cholesterol. But if you're in your 40s, number one, your age is higher. And then don't know, maybe you got high blood pressure, a bit of diabetes. And maybe also your life very stressful. You have so many risk factors to get stroke. And then plus you take hormone. That of course the risk is higher. So we have to also think about that. And then the last option is to go for surgery. Of course, if you remove your uterus and ovary, your endometriosis settle once and for all, never come back. But removing uterus and ovary also has its own problem. No uterus, no issue. No uterus, no issue. Uterus is no use. Uterus is only for baby. But ovary is a problem. Because ovary, when you don't have, you have no more hormones for the rest of your life. So let's say you're going to live until 80 years old. So the first 40 over years of your life, you have hormones. And the next 40 years, you have no more hormones. So that is also not so good because hormones is very important for women. Then your next question is, can I remove my uterus, don't remove my ovary? Endometriosis, the most important thing is the ovary because the ovary provides estrogen and then ovary has both estrogen and progesterone. In fact, it has more estrogen than progesterone. And as a result, endometriosis will still come back. What are you going to do? There is no difference compared to you do a surgery, you still keep your uterus and keep your ovary. Just like the younger people, they keep their uterus, they keep their ovary. They just remove the endometriosis and all the adenomyosis, everything they remove, but they keep their uterus and keep their ovary. No difference one. Then we talk about the complete treatment that I mentioned in my last video. The complete treatment to prevent endo from coming back. You probably need to do that. Okay? You probably need to do that. Complete surgery, not remove uterus and ovary, but complete remove all endometriosis. So that is the 3 options you have. You either choose conservative management means what also don't do, I just wait and see if I'm lucky enough, maybe it doesn't worsen, it doesn't turn cancer and I'm not suffering, it's fine. or you go for medical treatment, or you go for surgical treatment. But if you choose conservative, I can still help you in another way. Conservative treatment means you're not going to take medicine, you're not going to do surgery. But you could always still take the complementary therapy that I mentioned last talk that we had. As long as you're not suffering and the cysts are not too big, you're not worried about cancer, it is a possible option. So that is one thing you can do as the first option, that is you do not want to take medicine or do surgery. That is the first thing. And another thing is this month is Endometriosis Awareness Month. So let's make more people aware of endometriosis. Please share this video as far as wide as possible. So that's all for now. See you next week. Bye bye.